Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and I'm here with my co-host, Alara Sky. Today we're going to talk about one of the most common misdiagnoses in medicine, urinary tract infections, or UTIs. We'll cover why they're frequently overdiagnosed, especially in seniors, and how antibiotic overuse can lead to bigger health problems. Let's start by breaking down exactly what goes wrong in these diagnoses and how it affects so many people.
Thank you, Ethan. Urinary tract infections are typically associated with symptoms like burning during urination, pelvic pressure, urgency, and cloudy or strong-smelling urine. However, it turns out that many people receive an antibiotic prescription even when they don't display those symptoms. In older adults, for example, it's common for bacteria to show up in the urine without actually causing an infection. Yet they're still given antibiotics, and that leads to unnecessary disruption of the gut microbiome and increases the risk of more serious issues such as antibiotic resistance.
This over-reliance on tests and single indicators is a major concern. For instance, doctors often base a diagnosis solely on urine tests that reveal bacteria or a cloudy appearance. When they see that, they'll prescribe antibiotics, sometimes without asking about the patient's actual symptoms. Research shows that up to 75% of patients labeled with a UTI in certain hospital settings had no matching symptoms, and in some states, overdiagnosis rates can be as high as 85%. This practice is especially risky for older adults because many already have harmless bacteria in their urine.
Exactly. It's what geriatricians call colonization, rather than an actual infection. Seniors might feel weak, confused, or dizzy for a variety of reasons, but it's too often blamed on a supposed urinary tract infection. Once a lab test shows bacteria in the urine, the wheels are set in motion for antibiotic treatment, even though there's no symptom-based evidence of an actual infection. A big part of the problem is what some physicians refer to as diagnostic momentum. Once a misdiagnosis is made, it tends to carry through unquestioned.
In hospital settings, this problem can escalate. There was a study published in BMJ Quality and Safety showing that nearly 28% of hospital patients treated for a UTI were incorrectly diagnosed. Over 80% of those patients continued with antibiotics for at least 3 days, even when further evidence suggested that an infection wasn't present. That continuation of treatment puts them at risk of side effects like C. diff infections and contributes to the spread of antibiotic-resistant bacteria.
We're also seeing that hospitals with high overdiagnosis rates for UTIs often overdiagnose pneumonia as well, suggesting there's a broader pattern in how they're managing infections. Beyond hospitals, there's also a growing concern about how bacteria are adapting. E. coli strains, the main culprits behind UTIs, are developing resistance to many first-line antibiotics. They form biofilms in the bladder, which is a protective layer that makes them even tougher to eliminate. The more antibiotics they're exposed to, the smarter and more resilient they become.
Yes, and medical reviews have also taken aim at some persistent myths. For instance, relying on urine clarity or smell is highly unreliable. A study showed that doctors diagnosing UTIs based on urine cloudiness were barely more accurate than random guessing, and the smell of urine can often be influenced by hydration level or recent meals rather than an infection. Another myth is that yeast in the urine always means a fungal infection requiring antifungals. In reality, yeast is frequently found in catheterized patients, and if they have no other symptoms, antifungal treatment can do more harm than good.
Another critical misunderstanding is that older adults who become mentally confused or have a fall must be suffering from a UTI. But according to published data, cognitive issues or falls in seniors can be due to many factors, like dehydration, drug interactions, or low blood sugar. When there's no fever, pain, or other infection symptoms, the best approach is usually observation, rather than jumping straight to antibiotics. Unfortunately, this advice often goes unheeded, leading to excessive prescriptions and all the associated complications.
So, what can be done instead? One of the best approaches is prevention and targeting the root causes. A major point Dr. Mercola highlights is to avoid eating meat from concentrated animal feeding operations, or CAFOs. These facilities frequently use antibiotics on animals, especially poultry, which fosters antibiotic-resistant E. coli strains. If that meat is undercooked or not handled carefully, these bacteria can be transferred into your body, making UTIs more likely and tougher to treat.
Showering instead of taking baths is often advised because baths can expose the urinary tract to more bacteria in the water.
There's also an interesting strategy involving methylene blue. Dr. Mercola mentions that pharmaceutical-grade methylene blue, at around 5 milligrams daily, can concentrate in the bladder and destroy harmful bacteria without wiping out the entire microbiome like broad-spectrum antibiotics do. When combined with whole cranberries or organic cranberry juice, it can help prevent bacteria from attaching to the urinary tract walls. That reduces the likelihood of an infection taking hold in the first place.
Another piece involves proper sun exposure. The idea is that sun exposure boosts your body's cellular energy production, assisting your immune system. But Dr. Mercola emphasizes removing vegetable oils from your diet first. These oils contain high amounts of linoleic acid, which can oxidize in the skin under strong UV light. By gradually clearing these oils from your diet, you minimize the risk of sun-induced damage while still enjoying the immune-supportive benefits of sunlight.
And finally, there's the concept of grounding, which is maintaining direct contact with the earth. Some people try grounding on land, but according to Dr. Mercola, the electromagnetic pollution from power grids can interfere with the process. Grounding in the ocean, however, is a more stable way to connect with the Earth's electrical state. The salt water conducts electricity effectively, helping reduce what Dr. Mercola calls reductive stress and supporting cellular energy. These steps work together to tackle UTIs and other infections at their source instead of relying solely on antibiotics.
Each of these changes, avoiding CAFO meats, practicing better hygiene, using methylene blue and cranberries, optimizing sun exposure, and grounding in the ocean, aligns with a broader goal: preventing overdiagnosis and overtreatment. Let's not forget that overuse of antibiotics poses a risk not just to individual patients, but to entire communities, as it speeds the rise of drug-resistant bacteria.
Before we finish, let's highlight a few frequently asked questions. First, why are so many UTIs misdiagnosed? The answer is that many healthcare providers rely on lab results showing bacteria in the urine without looking for actual symptoms. In older adults, confusion or weakness is often blamed on a UTI, even though there are other likely causes. That leads to antibiotics when they're not warranted.
Another question is how CAFO meats contribute to UTIs. When someone eats this contaminated meat, the bacteria can enter the gut and later cause infections in the urinary tract that don't respond well to standard treatments. That's why switching to grass-fed beef or simply reducing meat consumption can help break the cycle of resistant bacteria.
People also ask why antibiotics are so frequently prescribed for UTIs when there are no clear symptoms. This usually comes down to habit, convenience, and those misinterpretations of lab findings. Medical staff might see bacteria in the urine and assume it's harmful, even though it could be asymptomatic colonization. And once antibiotics are prescribed, they often aren't stopped, even if further evidence shows no infection.
As for preventing recurrent UTIs naturally, we've covered several strategies. Choose high-quality meats, maintain proper hygiene, and consider adding pharmaceutical-grade methylene blue or cranberry products to your routine. Keeping your immune system robust with adequate hydration, sunlight, and a healthy microbiome also goes a long way. If you have repeated UTIs, it might be worth reassessing your diet and hygiene habits rather than relying on antibiotic prescriptions.
And finally, grounding in sunlight can help maintain strong immune function, which is crucial for preventing all sorts of infections, including UTIs. Just remember that if you still consume vegetable oils like canola or corn oil, take steps to eliminate them before spending extended time in the sun. This approach protects your skin from oxidative damage and allows you to fully benefit from natural sunlight's support for mitochondrial function.
This discussion underscores how easily an over-reliance on quick tests and old habits can compromise patient care. Preventive steps, along with a thorough look at actual symptoms, should be the norm. Addressing root causes, like overexposure to resistant bacteria through diet, can dramatically reduce UTI occurrences.
Absolutely. With that, we've covered the main points on why UTIs often end up misdiagnosed, how antibiotic overuse poses significant risks, and practical ways to lower your chances of facing these issues. Thank you, Alara, for walking us through such a critical topic. And thanks to everyone for joining us. We appreciate you taking the time to learn about a more measured and responsible approach to urinary tract health.
Thank you, Ethan. It's always good to clarify these health issues so our listeners can make more informed decisions. We hope you found today's episode of Dr. Mercola's Cellular Wisdom direct and helpful. Until next time, stay informed and take control of your health.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.